It's time for our nursing tip of the week, and in this week's tip, we are covering central lines. There are so many types of central lines, so I'm going to try and briefly run through as many as I possibly can and give you some fun facts and tips, but just as a side note, I teach all of this in depth in my ICU crash course. Central lines, also known as central venous catheters or CVCs, are all fancy names for a type of line that is inserted into a vein and leads closer to the heart, whether it is in the SVC, superior vena cava, or in the IVC, inferior vena cava. The first one we're going to talk about is an IJ central line that is inserted into the internal jugular. Here is a picture of an internal jugular central line. This drives me a little crazy because there are no pressure caps on the end of this, but just ignore that. Look at it here. These can have 1 lumen, 2 lumens, 3 lumens. These are a temporary line for patients that just maybe need a central line for a couple of days. We can draw blood off of them. We can infuse multiple medications. And fun fact, you can infuse incompatible medications into separate lumens, but you cannot infuse incompatible medications into the same lumen. Another type of central line is actually a tunneled central line. Typically, these are tunneled underneath the skin and go to like the subclavian vein and down to the SVC. These are typically surgically placed like in an IR setting. Another type of central line is an HD line for hemodialysis. Sometimes these are called trialysis catheters. This patient has an HD line right here. It is also inserted into the IJ. This patient even has a central line on this side, which is not uncommon for a patient to have both. One is being used for dialysis, the other one being used for like multiple medications. We can put multiple central lines in on patients and they can either be on different sides or sometimes they'll even stack them on the same side and they'll go into the same vessel. Another type of central line is a femoral central line that's inserted into the femoral vein and goes up to the IVC. Here's another picture of one. This is actually a hemodialysis line, most likely, that's going into the patient's groin. These are very temporary because they can be yucky, gross areas. The groin is not so clean, so we definitely want to switch this out as soon as possible at a good time when the patient's more stable. Another type of central line is a PICC line or peripherally inserted central catheter. These go into the arm and go up all the way down to the SVC. These are great for longer term access for patients that may need to discharge home on IV antibiotics because they are on the arm. Even though central lines still come with risk, there's less risk with the PICC lines just because they are further away from the heart. So infection and stuff, obviously still a concern, but these are a little bit safer for patients to go home with. The last type of line I'm gonna talk about really quick because we're running out of time are implanted ports. These are used for patients that need long-term medications for potentially years and years and years, like chemotherapy or other medication infusions. Here's kind of a crappy picture of an implanted port that is currently being accessed. At my hospital, we actually have to have orders to be able to access someone's home port. Okay, I know that was like a ton of information. Let me know if you have any more questions.